Indicators of the health is the first most important topic. Perinatal mortality includes the deaths. They didn't get you the notes. They will bring it. Till early morning 3 o'clock we had been preparing, even my team. So they just went for a small power nap to get the things. They will get you. Perinatal mortality, DNB CET 2001 से शुरू होके 15 साल के पहले 2010, 12, 13, every time it is the hottest question in the DNB CET. So it is after 28 weeks of gestation up to first 7 days after the birth is typically called as the perinatal period. So fetal deaths where the fetal age is more than 28 weeks and the deaths in the first week after the birth divided by the fetal deaths more than 28 weeks plus all the live births into 1000 will give you the perinatal mortality is what you have to basically remember. So you have the infant mortality, perinatal mortality, stillbirths and neonatal mortality, and within the neonatal is all up to 1 month. Infant is up to 1 year. Perinatal is from 28 weeks of gestation up to 1 week, newborn period. So that is basically called the perinatal mortality is what need to be remembered. Now the WHO said, if you only say 28 weeks, we don't agree. We will use some other parameters to decide that. Let me invite Dr. Ramya, Anu, Vinod, Manu, Sachin, Rifaz and many more across the country from the Pak occupied Kashmir up to Kanyakumari. Subbalakshmi in Kanyakumari is also our student. So from Razia Sultana in Pak occupied Kashmir. So we have got full extensive list of audience who have an access online. So be energetic till evening. To really keep you awake till evening is the biggest challenge of teaching SPM. It is not like cardiology, it is not like the brainstem lesions in neurology. Yeah, but what is the extended definition of perinatal mortality? So what they have decided is, if the crown rump length is 35 centimeters or if the birth weight is 1000 grams or if the gestational period is 28 weeks, any of this is considered to be equal. Just like chest pain is called angina and developing shortness of breath is called angina equivalent. Similar story in SPM. Now perinatal mortality, what is the denominator is, you should be very sure. So it is 1000 live births weighing over 1000 grams at birth, because 1000 gram is considered to be the standard equivalent to 28 weeks, which is equivalent to 35 mm of 35 centimeters of crown rump, 35 centimeters of crown rump length is what you need to basically remember. When will you calculate the mid-year population? Now we are talking the topic about indicators of health. Favorite highest number of questions in DNB CET. Typically it is the 1st of July when it is being considered, and easy to remember because July is the 7th month and 12 months means 1st of July is really also middle year. No big difficulty to remember. In infant mortality, what is the denominator? Typically the denominator is per 1000 live births, deaths under age of 1 year divided by live births in a year into 1000 will give you the infant mortality rate. What are the 3 things you are not going to forget about infant mortality rate, doctor? Health status of community if you want to know. आज की शिशु, कल की citizen, आज की नर्सरी स्टूडेंट इज टुमारो पीजी मेडिकल एस्पिरेंट। अगर उसके तबीयत खुश नहीं है तो पूरा देश की, वतन की तबीयत खुश कैसे रहेगा? तो इसलिए इट इज हेल्थ स्टेटस ऑफ कम्युनिटी, लेवल ऑफ लिविंग ऑफ पीपल इन जनरल and effectiveness of the mother and child health services. Everything is reflected by one indicator. What is that? Infant mortality rate is what you are going to remember. So once more, the same question, DNB CET 2013, even 2014 also, very recently. What is the best indicator of the neonatal and maternal well-being? What is your reflex answer, doctor? IMR is what need to be remembered. Now, whenever you say infant, he is up to 1 year. Within that 1 year, what is the most vulnerable period where highest amount of mortality is possible? Is the question. So, about 64.6% of infant deaths, they all occur in the first month of the life. So, that is the reason 0 to 4 months, mother will not have sleep. She is new to the baby, baby is new to her. It is like first time reading all the high yield topics which you never read in entire MBBS for the entrance exam. There are only two chances. Either you will start crying that do I have to read all this, or you will leave preparation and go away. So don't do that. First time, so tajub lagta, next time it is a game. You will enjoying it. So 0 to 4 months. Now which of the following includes the mortality rate in that country while calculating the indicator? Actually, the total fertility rate, the gross fertility rate, net reproduction rate and gross reproduction rate, they all look more or less similar looking. We get a squinted eye watching at them as to what is what exactly. So you must know the fine difference between them, which is the favorite question of the examiner. Pehla dekho. What is the crude death rate? Let's look at some indicators. Total deaths by total population into 1000. Some died without getting seat, some died after getting seat, some married and died. But whatever dead divided by total population is crude death rate. It doesn't reflect anything. You can't infer anything out of that. Total fertility rate. What is the meaning of it? It is the average number of births that happen for a woman, because only women can give births, no? During her entire lifetime. But the entire lifetime ovary will not be ready to produce the ova in order to encourage the sperm to lead to pregnancy. So that is a pitfall. A newborn is not going to produce, though newborn phase is a part of the lifetime. Postmenopausally she is not going to produce, but still what we are saying, the births that occur in the woman in her entire lifetime becomes total fertility rate. Not a very good parameter. Because a woman is not going to produce from newborn period until the 80th year of her life, she is not going to produce children. General fertility rate. So they said, let us not depend, because woman is not producing all the time, let us take the reproductive aged women. So it is the average number of births per 1000 women who are in the reproductive age, 15 to 49, is typically the general fertility rate. Then what is meant by gross reproduction rate? The number of daughters of a hypothetical cohort of the women by the end of their reproductive life, if she bears the births according to the age specific fertility rates without experiencing any mortality till the end of reproductive life. समझ में आया? Here 15 to 49 is called reproductive life. During that period of her reproductive life, the number of daughters that she is going to produce, because her daughters are going to once more produce children. So that is the reason sons are useless, because sons without daughters-in-law are waste. They don't produce children by themselves. So don't consider sons. Only important are who? Daughters. So the daughters born to the women in their reproductive life. Okay, and if she bears the births according to the given schedule of age-specific fertility rate without experiencing any mortality. For example, let us say we are all living in one island. We are all living in one island, doctor, in Korea. Assume there is a huge radiation in that island. They found that in this island, if a woman is living, she will produce only 2 out of 100 women are going to produce children in this island, right? So here around 100 women are there who are in the age group of 15 to 49. Let us say you are in Hyderabad. Hyderabad में तो radiation है. Warangal or Vijayawada, or you say you are in Nizamabad. Nice forests, beautiful rain, nice weather. Here it is being found not much of radiation. If 100 women of 15 to 49 years reproductive age are there, there is no other work, no PG preparation also. Only job is to produce children. Here 80 out of 100 will produce children. So 15 to 49 is the same age group, but the age specific fertility is higher in Nizamabad or in say Berhampur or Cuttack compared to the Korea. So if you take the age specific fertility, the number of daughters that these 15 to 49 age grouped people will produce is basically called as gross reproduction rate, is what you need to basically remember. Now there is one more element involved. They found that the women in California, they have high road traffic accidents, especially 15 to 49 year aged people who are doing high professional jobs, CEO of a bank, professor of medicine, professor of surgery, no men, only women in that country. Morning only 8 o'clock they take the car and then they drive at a speed of about 140 kilometers and go to the hospital and work. So here road traffic accidents are high. So 15 to 49 aged women are suffering a lot of road traffic accidents, let us say in California. So here the mortality is higher in them, they found, compared to the women in Nizamabad or Cuttack or Bhubaneswar or in Berhampur. So if you consider mortality statistics also, then that is not called gross reproduction, then it is called net reproduction rate. So the difference between NRR and GRR is, NRR takes into consideration the mortality pattern of the reproductive aged women, whereas the gross reproduction rate does not take into consideration the mortality of that age group in the reproductive age group. But both of them basically take age specific fertility rate into consideration. But what are the NRR and GRR looking at? The number of daughters produced by the women in the reproductive age group is what you have to basically remember. So NRR is the GRR which is being adjusted to the mortality pattern of the cohort of the women in the reproductive age group is what I want to underscore to all of you. So which will be lower between NRR and GRR? NRR will be lower because it is considering death, road traffic accidents, or not getting PG seat continuously. Committed suicides are high, like poor farmers. Then what will our situation is no better than poor farmers, please remember. 1,20,000 students are taking MD entrance and hardly 12 to 14,000 seats are there in MD. Nonsense, right? Then why we should be produced in such a large numbers, right? On the top of it, the norms say that we require more doctors per 1,000 population, and there the norms are asking for the supply, but we are being stopped at one level and produced very sparingly. That's a whole melody of situation. Now the number of live births per 1,000 women in the reproductive age group is, what is your answer? Number of live births is basically called general fertility rate is what need to be remembered. So what is the denominator in general fertility rate, doctor? Basically, it is the women in the reproductive age group in a given year is basically the denominator in general fertility rate. So once more, DNB CET 2013 question. General fertility rate is defined as what? It is the number of live births per 1,000 women in the reproductive age group of 15 to 49 in a given year will give you the general fertility rate. Now doctor, the crude death rate, the crude birth rate is 30 per 1,000 in a community of 5,000 people. So the number of pregnant females are how many? Can there be much easier question that you can pray God for than this? If you know multiplication table of 30, it's enough. So 30 is what the crude birth rate. So 30 is equal to live births divided by 5,000 into 1,000. So live births is equal to 30 into 5,000 into 1,000 divided by 1,000. That is equal to 150 is what you need to basically remember. So what is crude birth rate, doctor? It is number of births divided by, what is the denominator? Please don't forget. It is a mid-year population into 1,000 will give you the crude birth rate is what need to be remembered. Now what are the indicators of the health in India? Very good. Riggs is asking, sir, please provide the new update of the numbers of indicators and program. Definitely. Actually, that took a lot of time for me to prepare for this class. The new numbers according to the most recent statistics as much as possible. Yeah. What are the indicators of health? Basically, this was a question asked in 2009, but it had been modified for 2015. Okay. Now, crude birth rate is 19.55. Crude birth rate. For every 1,000 population, we are producing 20 new children. 20 new children. Then crude death rate is 7.32. 7.32. Total fertility rate is 2.48. That is also true. But what is the IMR? Infant mortality rate is 41.81 per 1,000 births, 2015 statistics. Deaths per 1,000 is 7.32 per 1,000. Then births per and the crude death rate is 7.93 in 2013, but 2015 how much it has become? 7.32. Then births per 1,000 is 19.55 per 1,000, right? Then growth rate is 1.22% is the present growth rate, and gross reproduction rate is 1.17 per 1,000 according to 2015 statistics. Then total fertility rate is 2.48 births per woman. Is 2015 statistics. Only God should help how to remember them. Chalo, use your better part of the frontal lobe to tell how are you going to remember. Online students can help us by throwing some easier way to remember. Deaths per 1,000. Death is Shani. 7 is a bad number numerologically. Huh? No, but Saptami is a good day to start anything. right? So 7.32, something or other. Infant mortality. See, how many are getting born, doctor? Around 20. Double that of them are dying. 40. Some better remember. Okay. Then growth rate is 1.22. Okay. So, but develop some funny way to remember, your own funny way, that you will smile when you write it. Huh? What is the growth rate? Double the growth rate is? Total fertility rate is double the, almost, yeah, 1.22. Please give one big clap. Total fertility rate is, loud. Total fertility rate is 1.22. Sorry, 2.48. But the growth rate is 1.22. ऐसा कैसे हो गया? मुर्गी ने 4 अंडे दिया, मगर 2 अंडे से ऑमलेट बनाए और 2 अंडे खाली बर्थ दिया. सो इसलिए टोटल फर्टिलिटी रेट 2.48 है. जितने अंडे बाहर निकले, मगर half of it only are becoming once more. So growth rate is 1.2 to half that of total fertility rate. अरे, come on doctor. चलो. Then MMR, maternal mortality rate is highest in which state of India? Yeah, Assam. Right? क्योंकि पहाड़ के ऊपर से ऊपर वाले पीएचसी को पहुंचने के लिए थोड़ा टाइम लगता है. तो बुलक कार्ट में बैठ के pregnant woman, by the time she go to the top of the hill in the Assam, either delivery occur or she will die on the way. So Assam, please don't forget. Another way to remember Assam has highest mortality is, whenever you are asked by your school teacher, write all the states. First you will start with A for Assam, A for Andhra Pradesh, A for Arunachal Pradesh. So that way also Assam is on the top in the numerical list. It is 328 per 1 lakh live births. So unfortunate. Then lowest maternal mortality rate is Kerala. Continues to register lowest maternal mortality rate, right? Because Mr. Menon will be asked to stop going to job and take care of his wife until across the year. Mr. Menon, Mr. Cherian, etc., etc. So be sure, Kerala, highest education, highly educated women, right? So it is a strong matriarchal society. So be very sure that it is lowest. So if you want to practice obstetrics, don't go to Kerala. Assam requires you very much. Then yeah, but one of the best obstetrics professor I have ever met is a Keralite. Everybody used to fear obstetrical labor, kya karna. He used to come, hey, move. And then with one hand he used to pull out and like a strong muscle kind of a guy. So, so that's the reason. Once upon a time gynecology means it's a male domain. Mudaliar, Shaw, Datta, everybody. Now, if neonatal tetanus is less than 1 by 1000, TT coverage more than 70%, and attended deliveries are more than 50%. What is that basically called as? Right? If the QRS height is how much in V6 and how much it is in the S wave in the V1 is how much according to Sokolov-Leon criteria, like that you should remember. With the same passion, neonatal tetanus elimination. Let us see. High risk means if the rate is more than 1 per 1000, TT coverage less than 70%, attended deliveries are less than 50%. Then when you call it as neonatal tetanus control, if the rate is less than 1 per 1000, TT coverage more than 70% and attended deliveries are more than 50%. Similarly, when do you call NT elimination? I am not going to read for you. So, but please take this table seriously, because examiner is very serious to know whether you know what is neonatal elimination values very clearly. Now, what are the most common cause of infant mortality in India? So, typically it is a low birth weight which lead to the highest cause of the mortality. LBW out 2020 match. Then child survival index. How are you going to calculate? If you don't know this formula, examiner is going to give the actual values and ask you to do a calculation in the DNB CET. So अगर फॉर्मूला नहीं है तो आप आसमान में देखे तो भी कुछ भी खाली अंगारक दिखाई देगा. तो 1000 minus under 5 mortality divided by 10 will give you the child survival. कितने children have survived beyond their 5th year of life comes from under 5 mortality basically. So 1000 minus under 5 mortality, that value divided by 10. Examiner is going to give you under 5 mortality and ask you to calculate child survival rate in the tomorrow's exam. In a village with population of 10,000, there were 1000 live births and 11 stillbirths. What is the stillbirth rate? Was DNB CET 2013 most recent question. So once more you must know the calculation. So what is the definition of a stillbirth rate? All the fetal deaths weighing over 1000 grams at birth during the year divided by total births during the year. Total births include live births plus stillbirths. Okay, so 11, which is the stillbirths in the numerator, divided by denominator is not simply the live births, all births, still and live. That is the secret of it. So 1000 plus 11 into 1000. So 11 by 1000 and 11 into 1000 is equal to 10.88 becomes the answer. So now you know how important it is. Indicators of health. Highest number of topics in DNB CET.